If my tattoo is not suitable for excision due to the size and laxity of skin, could you use a tissue expander to stretch the skin? Good question. Who are these people answering these questions, asking these sorts of questions? Because that's quite an informed question, I would say, and good on you, whoever's asked that question. I kind of feel that's almost a plastic surgeon asking that question. Well, not they probably know the answer, but tissue expansion is a technique of covering large defects that don't have to be covered acutely, that don't have to be covered straight away. So obviously if you've got a big cancer that you have to remove, or a big wound due to trauma or something, we have to cover those straight away. So we have to use certain techniques to do that. But if you have got time, if it's not an urgent or an emergent procedure, then there are other techniques you can use to import large pieces of skin, and tissue expansion is one, where basically you put kind of like a balloon, we'll call it a balloon for the sake of understanding, underneath the skin. You blow the balloon up, that stretches that skin, same as like what happens when you have a baby. Basically, your tummy skin gets stretched, and then you can take the balloon out, and then you've got a whole load of stretched skin that then you can use to cover the defect. And so it is a technique to kind of grow more skin, I guess, because that's what happens when you put skin under tension. More skin kind of grows. It's called the stress relaxation phenomena, and it's a property of skin. When you put it under tension, it kind of grows more skin, if you like. And so the tissue expander is a way of exploiting that. Now, so if your question is, could a tissue expander be used to expand the skin? So what you would do is you would put it next to the tattoo, you would expand the non-tattooed piece of skin, and then you would take the tissue expander out and use that, cut this big tattoo out, and then use that expanded skin to fill the defect. So could it be done? Yes. Simple answer, yes, it could be done. Would I do it? No, I wouldn't do it, for a couple of reasons. One reason is tissue expanders are not good on the limbs. They've got a high complication rate on the limbs, and often tattoos are on the limbs. There are certain areas where tissue expanders work really well. The breast, for instance, a breast reconstruction. So if someone has a mastectomy, they've got a flat piece of skin there because they've had the breast removed, tissue expansion is a really good way of treating that. You can put a bag underneath the skin and you can blow the bag up. The kind of classic, I guess, area for the use of or the indication of tissue expansion is on the scalp. If you have a bald patch, if you have a car accident on an open top car and you take the top of your scalp off and then you have to have a skin graft or something, then you can expand the hair bearing skin and use it to cut out the skin graft and put hair bearing skin. Now that's good because it's a specific quality of the skin next door to it, that it's got hair on it, and then you can use that. So a couple of areas where it's good, but it's not good on the limbs. But also it's quite a big deal, tissue expansion. You might see these people with these weird sort of, they look like sort of, they've got these weird growths basically because they've got these bags. Sometimes if you have quite a large area, you can put 2 or 3 tissue expanders around the area. You have to come back to clinic every so often, maybe every week, maybe every couple of weeks, to have there's a little kind of buried port usually. Sometimes they're externalized, the ports, but basically there's a little port where you can put a needle in and inject fluid to blow the tissue expander up. So you have to gradually blow it up. It looks odd, and it's also actually quite, and then once you leave it for a while, then you take it out, it's also actually quite often, I find, quite unsatisfactory, the amount of skin that you get from a tissue expander, and you often have big dog ears, big bumps where you've turned the skin over to fill the defect, and it's quite an involved procedure. And in sort of answer to the question, if someone says, would you use a tissue expander expander? My answer would be, my preference would be not to use a tissue expander. My preference would be to do a serial excision. So you might have heard me talk about serial excision before, where you cut a piece of the tattoo out as much as you can, really tight. You leave it 4 months, and then you can cut more out because it's not tight anymore. That's relying on the same concept as tissue expansion. So it's utilizing the same quality of skin, that when you put it on tension, it grows more, but it's doing it in a different way. And it's doing it in what I would say is a more kind of less complications and sort of easier to deal with way than putting tissue expanders under the skin. You know, it's quite intensive thing to use a tissue expander. Say people have to come back to clinic regularly. There's a high complication rate. Complications being things like extrusion and things like that. Not to mention the physical nature of having a big plastic bag underneath the skin, or balloon or whatever. And so I feel that serial excision is a better way to remove most tattoos. I've certainly never used a tissue expander for a tattoo removal, and it's not high on my list of ways that I do it. And it's a very personal thing. Like last week or the week before, sometimes I was talking about skin grafts. You know, some people might do skin grafts. Personally, I don't do skin grafts. Personally, I don't do tissue expanders. You know, I do excision, which is just cutting around and stitching them up, which is sort of the mainstay of it. But if it's too big for excision, then serial excision, which is taking as much as I can and then coming back 4 months later. And as I say, it's the same concept of tissue expansion, but in my view, fewer complications, less kind of intervention, and less kind of a more manageable from a patient side of things. Both in terms of the amount of times you have to come back to clinic, and also in terms of the fact that you have a big bag you have to deal with that's going to be a bit uncomfortable and can look odd. So for all those reasons, my preference is serial excision rather than tissue expander. But as I went back to the beginning of the question, can you do a tissue expander? Yes, you can. It can be done, and there might be someone out there who's doing tissue expanders for large tattoos, but I'm not him. So yeah, good question. I like that question. Well done.